Good afternoon, ladies and gentlemen. Thank you very much to be here in this late session at the day, the session of the game where we are going to step into the shoes of another organization. And we are going to step into the shoes of an organization that has a place in the ecosystem of the pharmaceutical strategy in Europe. As you're probably very well aware, the European Union has a recently new pharmaceutical strategy. And most of you who are involved in public health or specifically in the pharmaceutical, you are probably very well familiar with the strategy. What we notice in talking to different colleagues is that it's not always as obvious that you're very familiar with the position of other organizations. And that's exactly what we're going to do in this game. So the game is about a pharmaceutical ecosystem. And in the game, we have 10 stakeholders. And as you can see, there's now 10 flags around the room with 10 tables. And around each table, we have gathered a group of new people who are, for the next hour, part of that stakeholder community. And even though your interest as a stakeholder could be slightly different than your neighbor, what we all share in common is that we are committed to make sure that the ecosystem of pharmaceutical strategy in Europe is healthy and sustainable. And that's exactly what we're trying to do in this game. Now, in order to help you make decisions, because this next hour is about making decisions together, supporting decisions that will benefit the entire ecosystem of the pharmaceutical strategy. In order to help you, we have created a dashboard of 6 key performance indicators. And you can see them here on the monitors around you. And I'm very much aware that we also have online viewers. Unfortunately, you cannot join us. It's almost like watching a football match without the sound. But we still hope that you will get something from our interaction that we're having here in the room. Now, if we look at the dashboard, we see 6 indicators. And these are societal needs, something that really is on the forefront of almost every strategic document about the European strategy. Universal access to medicine, innovation in terms of research and development, but not only research and development, but also reaching out, thinking about the role of pharmaceutical in our society. So innovation in a very broad sense. Obviously, quality, safety, and efficacy. Competition and competitiveness. If we talk about keeping a sustainable ecosystem, then we need to find the right balance, that there are enough incentives from the competition and competitiveness perspective, but not to that extent that the ecosystem cannot be sustained. So that is another important indicator. And the final one, last but not least, is healthcare sustainability. Now, as you can see at this starting point, we are not starting at a very good moment in this game in the health of the European ecosystem. Basically, what we see here is the red line is actually the line under which we do not want any of these indicators to come. And we see that several indicators like societal needs, universal access, and healthcare sustainability, they're in the red. So they're far below the line that we consider acceptable. There are 2 who are on the line, innovation and competition, so they're amber. And there's only one, maybe not a surprise, quality, safety, and efficacy is in the green. Now, the purpose that we have in the next half hour, because we're going to play this game in 2 rounds of half an hour, is we're going to make decisions. So in front of the table, what you see is basically a very short summary of who you are. It's almost the reason of your organization in a tweet. So that's the purpose of your organization. And you see the 2 key performance indicators that matter most to your organization. Now, on top of that placemat, that sheet, you will see 4 stacks of cards. Please leave the cards currently as where they are, because we will get to them quite soon. So these 4 cards represent the choices that you can make in the first round. There is a 5th card, which is kind of in this box. It's not yet opened. That's the one you're going to get in the second round. But in the first round, you have to first agree among your own group of stakeholders which action out of these 4 you would like to give priority, you would like to submit as a proposal in order to create better health of the ecosystem, to improve these indicators. And the way we go through this game is basically, if you make a decision like that, if you look at here, the PNR actors, which are over there, I believe. No, they're over there. Yeah, so very important. The pricing and the reimbursement actors, and the Ministry of Health is also part of that. In this example, they have made an action. We don't know which action it is, but they made an action. And what you see here, how it affects the ecosystem. So in the shaded areas, you see where the KPI were. And due to this, thanks to this action, we see that societal needs has gone up from red to amber. We see actually that competitiveness has gone down. And healthcare sustainability has increased slightly, but not a lot. So this is basically how it works. And maybe if they had made a different choice, maybe there was another effect. Now, what you can also do in the second round, in the first round, you're going to decide what you're going to do. But in the second round, you're going to lobby. You're going to go to other tables, and you're going to get support of your decision. So that's why you have a stack of cards, because it's not just that one card that you use for the action. You use all the cards to talk to your colleagues and to say, do you want to support my action? Because if another stakeholder supports your action, then the impact of that action is increased. And that will increase kind of the effectiveness of what you have decided. The point is that you only have 10 minutes to speak to the stakeholders, and there's a lot. So be very smart in which stakeholder you're going to select. And the other thing you need to understand is once you have talked to the stakeholders, you need to go back to your table, because you probably will have received a lot of requests for support as well. And these cards will now be on your table. So with your group, you have to decide which of the requests for support are you going to award. And you can only support 2 actions. So it could be that 8 stakeholders came to your table and they said, do you really want to support this action? So you have 8 cards on your table, but you can only support 2 of them. So make the best choice for the ecosystem. So these are the steps that we're taking in this game. 5 minutes to discuss your own action. And once you have decided on your action, you come to us, to this table, because this is the table where all your actions are being implemented. We have a sensor, and you put your card, your answer, on the sensor, and your decision is registered by the system. And we will take your card. But you still have 4 cards left of that stack. They're exactly the same, they're identical. And with those 4 cards, you're going to go for 10 minutes, talk to other stakeholders. But make sure that there's at least one person staying back at your table, because you have to receive requests as well. So decide who's going to stay and who's going out to lobby. We will give you an acoustic signal at the end of those 10 minutes, because then you have to go back to your table and decide which 2 actions you're going to support. And after that, you come to us again with your 2 cards of support. We register in the system. And then, after 30 minutes, let's see how the ecosystem has changed, how much we have improved the ecosystem. One important disclaimer: it is a game. It is not an academic model. It's not a quantitative kind of computer simulation of real life. It's a game, and the game mainly is to kind of get a different perspective, but also to get questions and maybe some confusion that you can use as an input to the panel discussion after the game. Because after we have played 2 rounds, what we're going to do is a very quick debrief about the game result. But the most important thing is there will be a panel discussion that is going to talk specifically about this topic. It's going to talk about the pharmaceutical strategy. And I'm sure that kind of the things you discover during this game, they may actually be quite interesting questions for the panel to discuss after the game. So basically, that is what we want to do. Are there any questions for clarification? Don't worry if a lot of the instructions kind of already went past you. We're here to help. There's a lot of colleagues from our team, and we're going to help you through every step of the way. Yes, as a table, you can support 2 other groups. Yeah, and that is if at least 2 groups were able to find you to ask for support. And be careful, because that's not always happening. So look for empty tables. So are you ready to step in somebody else's shoes? In that case, the clock is running. So you have 5 minutes to discuss.
Should I give him a microphone? Do you want to have a second microphone?
You have 2 minutes left. There's 2 minutes left.
So we can still lobby for
Yeah,
that.
I mean,
we can just
we
choose
all of us
one
go
that's
somewhere.
exactly.
Okay.
So
Yeah, perfect.
it's just that we can already put one forward like directly.
Yeah. Also because I think we will be the only ones.
But if you look at the indicators, like universal access is like one of the lowest ones.
Yeah.
So we really need a maybe, because that's definitely one of our top
Then it would be
focuses.
this, maybe.
Is that then something that we want to push forward because the indicator is so low, or is that something we really want to push with the lobby? Because I think it's a strong lobby to say that the indicator is bad.
Yeah.
Yes.
Would any of these impact universal access though?
Who would support us with the universal access?
The commission, healthcare professionals.
And
the
generic biosimilars.
Yeah.
Yeah, so 3 of us should go there.
Yeah.
Yeah. Can you only...
But somebody needs to stay here.
I'll stay. Do you mind if I stay? My feet are hitting me.
We need someone to sit down.
Good criteria. So which one do we bring in for our own? Is it this one?
I think so.
Yes, because...
Yeah, because that's
Okay,
the...
That's
we're gonna-
our
Yes,
main
because
priority.
probably nobody else wants.
Okay,
Yeah.
30 seconds for your decision.
We need to like push ourselves in.
Yes.
Yeah.
Force ourselves
Yes,
in.
that's our choice. And then we need to lobby these,
Yeah.
the others.
And we can also lobby this one.
Yes.
I mean, yeah,
think
for
so.
sure.
Yeah.
Yes.
And we should. But like, we can work with multiple.
Yes.
Because we are 5, so I think there's still 5 cards of each left. So everyone can take
we're not
one
gonna
of the
stay 10
cards.
minutes
Yes.
with the same people.
No.
No.
So we're gonna have to, like bees,
Yeah.
going around.
You're lobbying us already?
End of this phase. So make your decisions.
Yes.
Make your decisions.
One person brings the card in hand.
One person of each table is invited to come here to register your choice. You leave it here,
Okay.
and the other 4 you can lobby.
Okay. It's done. I left.
Take one of these.
No, they're not supported. So please bring your decisions here to the central table for implementation. And when you're done, you can start your lobbying phase. You have 4 cards left. You have 4 cards left, and you can start lobbying.
But anyway, I will come.
It's J, the J.
So,
Here we are.
and what happens?
Oh no, we still need
Where are the PNR actors and the Ministry of Health? We need your decision now.
the same issue to different organizations.
How many cards do you have left?
4 or 5 now.
Yeah, we can mix it up as well.
So now you have to lobby to other groups to get support. But make sure that your stakeholder table is also represented. Ladies and gentlemen, can I please have your attention? Can I please have your attention? Ladies and gentlemen, please stop your lobbying for 1 second. I'm going to stop the time. I'm going to stop the time. Some people have taken all the cards off the table to lobby. You cannot do that. Once you have made your decision in the first round, you can only get support for that action. So you can only get support for the action that you registered. The other cards will stay until the next round. So please bring back those cards to the table, because otherwise you have no choice in the second round. Thank you. The time starts again. I think Jan is found this. Take a little bit of time.
Tailoring innovation to specific innovation needs. And therefore it's important for the future to prepare the
Thank you. I think it's in line with our theory.
Hey, there's Digger. I am patient. Do we have 2 more cards? No.
So we've been given 2.
Okay.
Yeah, I have 2 as well. So soon we will need to. To promote common understanding of unmet medical needs and tailor EU incentives to steer need-driven
One more
innovation.
minute.
But let's wait for Oliver
One more
in
minute
his
for
update.
lobbying.
Was it success?
I think so.
Perfect.
The European Commission.
I also talked to the regulators and they agree with us.
They didn't promise anything, but yeah,
But they did score.
they took it.
Lobbied for unmet medical needs.
I think that's a good one.
Yes.
Yeah.
So this
I like
one,
that, yeah.
and also this needs-driven innovation, and they solved that with a frame of unmet medical needs.
I
With
think these 2 personally.
yeah, me
I think
too.
they have the highest impact.
Yeah, me
These
too.
seem a bit more.
And they have the highest
specific.
impact to university.
This is the end of the lobbying phase. We are now in the support phase. Please go back to your own table and discuss which request you're going to award. You have 5 minutes to make the decision. And once you have made the decision, please come to the implementation table.
would be easier if we had more cards.
Yeah, but then they have more decisions to make.
Yeah.
Because they really, like, the organization that I went to, I got quite a lot of cards. So I was like, I kind of want to know now, otherwise I'm gone.
Okay, so what's the other step?
I think European Commission, they lobbied us, and then also HTA.
We should have definitely agreed on, like, you support us, we support you. We didn't do that, did we?
Yeah, no.
Yes, but are we going to go to the second round now?
Yeah, we can try
Afterward?
that.
We have 2 minutes to decide on your support activity.
Now I see. Yeah. That's good. So we have a match there.
Hopefully.
I mean, of course they do.
Oh, you went to what is it? This regulator?
Yeah.
Extra round 2. We still have the same
Oh,
score.
but that's actually good because that indicator is very low now. So that's
Access and all member states.
But I
1
don't
minute
have
left.
that.
But we have to
Yes,
maybe
but we
see, like,
cannot
how
promote that one. If this is the
Yeah.
round 2.
If you have your support, please come to the implementation table. We already have
We're really
one
quick.
stakeholder group delivering this.
Was it difficult? He said it's model, but
So we have here the R&D partners. Thank you.
So you go with them, and have we won?
We're going to see. We have all the scans. So, healthcare. Thank you. And we have the Ministry of Finance. Yes.
Finance that supports
Excellent
Thanks.
We still need support from factions. If you don't want to support anyone, we're going to close this round now. So please come with your support or we're going to close the round. Last call for support, or we're going to close the support session. 3, 2, we have one, yes. Just in time, the regulators. Thorough decision as always.
It's the payers. What can we do?
Okay. Payers? And then we have the European Commission. Yes. You're never late, so that's good. Yes. Thank you. Okay. So now we're done. And we start around. And can we switch to... Could we please switch to the second screen? The output. Yeah? Yes, thank you. So, let's have a look at what decisions were taken. We start with the PNR actors and the Ministry of Health, which are over there. They decided to choose the action, request proof of added therapeutic value upon market entry. So let's see how that influenced the system. Can you click the next button? So, what happened is that the system, the healthcare system sustainability went up. So that's good. But competitiveness went down. Innovation went down. Even universal access went down. But quality and safety and efficacy went up. So there are some positive effects, but there's also some unexpected negative effects. Let's see if they got support. Did anyone support them? They were supported by the Ministry of Finance, not a surprise, the HTA agencies, but also by the healthcare professionals. So that means that if we go to the next level, we see that all the effects are amplified. So the healthcare sustainability has improved. So it's also logical that the healthcare professionals supported it. So quality, safety, efficacy, also not a surprise from the healthcare professionals why they supported it. But we have a problem with innovation, and we definitely have a problem with competitiveness. So let's quickly move to the next decision. And that was the decision by the European Commission, probably. Yep. And they decided to tailor EU incentives to steer needs-driven innovation. Okay, so that means actually that we expect something to happen here. What's happening there? The societal needs go up. That makes sense because there's a needs-driven innovation. Probably innovation itself doesn't change that much, but because the innovation itself doesn't change that much, but you know the way it is targeted. So it's probably exchanging one type of innovation for another type. What really works well for the healthcare sustainability, but competitiveness, by this decision, competitiveness is really much more detrimented. So let's see if they were supported by anyone else. They were supported by PNR actors, the Ministry of Finance, and patient organizations. So the impact will be even bigger. And of course, we cannot go lower than low for the competitiveness, but in the next decisions, we need to do something with our competitiveness. So yes, let's move to the next decision. The next decision is by the Ministry of Finance. Yeah, you have to click on the next. The Ministry of Finance is getting on the screen quite quickly. Yeah. And yes, they make a grant entry, the Ministry of Finance. Say they chose to de-risk the R&D process. And they do that through advanced purchase agreements. So that makes sense. You can decide it as Ministry of Finance. What impact does it have on our ecosystem? Well, the healthcare sustainability went up, especially because reducing the risk, also for societal needs. But what stayed more or less the same are the indicators in the middle. Were they supported by anyone else? If we go to the next one, we can see the changes. But can you show the support? They were supported by the R&D-based industries. So at least there was one stakeholder group supporting that. Can we move to the next one? So now we see that at least we have 3 indicators above the line, you know. So basically we've improved on some areas, but not in all of them. So then we go to the next one, which is from the top of my head, patient organizations, the E. Yeah, you can click on next. It's the regulators. They decided to strengthen collaboration with downstream decision makers, so the HTAs, the payers, etc. What is the impact of that? We see that it increases universal access, which is good. It even increases quality, safety, and efficacy. Not much about competitiveness, which is also not what we would have expected. So yes, there's pros and cons here. Support, can you show the support? By the R&D partners. That makes sense. So we move now to the F. From my perspective, now we move to the patient organizations. And this would be interesting to see the perspective of the patient and what they chose for. They chose to ensure patient engagement in decision making, something definitely also that came, one of the conclusions from the previous panel discussion, to make sure that all sectors and also hard to reach groups are engaged in the decision making process. How did that impact on our ecosystem indicators? Can we take a look at that? Well, we see that the societal needs having improved and the universal access, which is something that you would actually expect. The healthcare sustainability was kind of more or less negatively impacted. Not so much, but still. How was the support of this group? It was supported by regulators and HTA agencies. So then we move to the next one. We have to go quickly through the indicators because we have a second round. And now we see that already 4 out of the 6 indicators are above the red line. So we're going in the right direction. So these are the generic and biosimilar manufacturers. And they chose the action to extend the BOLAR exemption to cover all administrative steps up to the pricing and reimbursement of applications. So to really speed up to the moment that a patent the timeline of the patent is up. So how has that influenced the indicators? If we can take a look, we can see that quality and safety is at the maximum, so that's pretty good. We were not so concerned about that at the beginning. We see that the healthcare sustainability is up. We see that universal access is up, which is also, I think, something that you would hope for in a decision like this. Innovation goes down, which kind of makes sense for these type of decisions. And unfortunately, we're still at rock bottom in terms of competition and competitiveness. Maybe this is a message for our discussion in the European ecosystem. Can we look at the next one? We have a few more to go before we have the second round. So the next one is probably... Oh, sorry, we need to look at the support. So they were supported by the Ministry of Health and the PNR actor, so that's a single support. We're kind of seeing kind of green lights now, so we're not doing very bad, but we have some attention focus. Let's see if the HTA agencies could help to make a difference. So they chose to promote a common understanding of unmet medical needs. I think this is so important because to have to share the same definition of what you really mean by an unmet need, how would that influence our ecosystem? If we look at the next one. So the healthcare sustainability goes up, and the societal needs go up. The first one I would have expected. Here I'm a bit surprised, but sometimes you have surprising impact of decisions that you take in the system. Were they supported by any other groups? By patient organizations and healthcare professionals. So that very much makes sense in terms of stakeholder groups. That means that the impact that we just saw was also incremented. We're nearing the end. We go now to the research and development-based manufacturers. Oh, sorry, we're going to the healthcare professionals. They choose clinically relevant endpoints through early dialogues, especially when we look at clinical trials, when we look at new research and development. The input from the field and from almost, I would say, from the bedside, is a really important one. So how does that influence the indicators that we are looking at? We see that the healthcare sustainability moves up a little bit and the rest not so much. Were they supported by other groups? Yes, by the R&D partners. Which is basically really good because there could be a controversy there, but that's really good. The next one is, we still have 2 more to go, and then we go to the next round. The next one is the research and development-based industries. And they chose to implement new incentives in the shape of transferable exclusivity vouchers for novel antibiotics. So this is really another priority element of the European agenda, very difficult to address and to create incentives. So let's see if this type of incentive could help. if we look at the impact of that one, what do we see? We see that innovation goes up, which is basically what we wanted, because that one was not in a really good shape. The healthcare system sustainability was impacted negatively a little bit. So how about the support of this group? They were supported by no one. This is really something, I think, to discuss at dinner tonight. So the transferable exclusivity, you supported it. Okay. Thank you for doing that. There may be a malfunction in our scanner. I'm sorry for that, but it's good that you raise your voice. So. Well, it wouldn't be the first time that the Commission would really be struggling, with the IT technologies and to manage across the platforms. We really apologize for this. But it's really good to know that, in principle, the Commission would really support a decision like this. Maybe we can correct this in the second round. If we move to the last one is the joint, the research and development partners in the network. So this is academia and other SMEs that are doing clinical research. They decided to contribute or to join European clinical research networks. How does that impact this final decision? How does it impact our ecosystem? Well, for innovation, it's really good, and we hope that this would really help. For competition, unfortunately, not so much. So let's see if support really cranks it up to the green level. Who supported this? They were supported by, of course, the R&D-based industries. So that means that we're really getting close to the green level here. So the key message is, in the second round, we really need to make sure that every decision we try to take is focused on improving competitiveness and competition. So by now, you probably have answered all the questions that you had about playing the game in the first round, but just by doing it yourself. I want to invite you to go to the second round. We're going to do the same. We're going to help you with the timing. And you can open the card box, which is on your table. So now you have 4 choices again. You can turn around your placemat. You did. So the placemat has 2 sides. And you can make a decision of the 4 choices that you now have in front of you. And you have 5 minutes. I'll give the message.
But we can maybe, are there any actions that positively affect competitiveness but negatively affect the indicators we care about?
I'm learning.
I mean, we only have those options, so it's.
Unfortunately, I'll have to tell you that we must be quite quick because we will have to wrap up as quick as possible.
This is the most important one from a patient.
Yeah.
I think.
Yes.
I mean.
Okay.
Let's do that.
Yeah. I mean, it will probably negatively affect. Companies want the product.
Who wants to lobby? I don't mind staying here. I already lobbied, so I can lobby. You do want to lobby with?
Stay here. No. Okay.
I can go. Do you want to go, or do you want to stay?
Who do we? Where do we lobby? You can leave your shoes
We
here.
need to lobby.
Already, or who are we gonna lobby?
The Commission makes sense,
We're
right?
gonna log in that one as well.
European Commission.
I'm gonna bring it there.
Regulate.
He wants to.
Yes.
Yeah, generics.
Generics.
I'll go to the European Commission then.
And they also score the competition.
No.
Okay, I'll bring my card there.
Okay.
Sorry? So, yeah, so choose not all actions. So that's good. So now it's an action. Yeah, so you say done. So you are there. So you go to so it's fine. It's fine. Yeah. So you're regulators. You see that the regulators. Thank you.
Now we need to wait for. No, I think you can go because they want to speak.
Okay, yeah.
Okay. We're staying here.
Yes. We need the decision of the Ministry of Finance and the generic and biosimilar industries and the healthcare professionals and the R&D partners. R&D partners.
You have an idea? Oh, you want to sit again?
So what did they do?
So we have something that's less strict. It's raising awareness of the benefits of generics and biosimilars, but that's what we want to do, which will increase universal access.
You have 4 minutes
Sounds
to
like that
lobby.
is also our focus.
Yes. So and
Ministry of
it's
Finance.
as efficient as safe.
Where is your action?
as the
Ministry of
non-generics.
Finance.
So that's our action.
Yeah,
What
we
do you
can
think?
consider it. Hello.
So I come from the based industry.
Yes.
You did it.
Where information on new medicines that is made available, and then we can track how long it takes for authorities to make decisions on reimbursement. Describe, what's the time that it takes for medicines to actually become available. So we think that will lead to
Do you think it strengthens also the competitiveness?
It's also making sure that innovation is rewarded. We don't want innovative products to sit
Might actually also our other focus is the quality safety of
It's as a patient, and our aim is to strengthen the medicine safety requirements and pharmacovigilance system. Safety of drugs is the most important.
You have 2 minutes for the lobby phase. 2 minutes.
And therefore, we ask for your support.
I don't want to jump ahead. You go first. No, we are from
it's in the best
We're from the same
organizations.
I think I can't promise anything, but I think this has a good chance. Because we care a lot about the quality and safety.
That's right. That's our
safety.
1 minute to lobby.
So this is creating awareness, raising awareness, and this is actual manufacturing.
Public manufacturing.
So do you think that that's better than that one?
So the generics company, they have a vested interest clearly in getting that. I think on this line we are more or less similar position.
Okay.
With the difference that, I think as a Minister of Finance, our action can be a bit more impactful. They are going to benefit as well. So if you want to catch both, if you like both, I say go for ours because we can help them as well. So,
but this lowers the competitiveness in the market.
Why you want to promote it?
If the public comes in and brings public money.
our thinking is that at the regional level we can see more players entering in the generic market.
So the lobbying stops, and you need to go back to your table to decide on the support you want to give.
Start back? We will think about it.
Yes.
Thank you.
Okay, no and no.
Glad you made a pre-selection.
That's the same as Mola, as we said, or earlier introduction. So that's all about getting generics in more quickly. Yes, except that's public. I'm sorry. If I can, I will.
The problem is,
it's like, will the people use it?
this is for, it's not for people, this is for industries.
Okay, now then let's do that.
We can go with two.
Yeah.
Yeah, but we have one. I mean, we could choose them both if we don't.
So it's 2 out of those
I don't
three.
understand the value of this. Raise awareness where?
Well, I think it's about,
It's costs.
yeah,
Generics aren't gonna
so
address it.
sustainability. I think.
Awareness is fine. I'm not sure about public manufacturing.
No.
I don't see why patients would really be necessarily in favour. I mean,
I don't see
it's a lot of
anybody
public
would
money
benefit.
going to something that's not going to address unmet medical need
Yeah.
in the health system.
But in the end, like, it does make sure that it's more accessible, which is of interest to us.
It's just
That's
promoting.
what you're hoping.
But
I'm not sure if
the
that's.
competitiveness goes down,
It might make it cheaper. We don't
Innovation
know.
will go down.
yeah, we don't.
Yeah, we
But
don't know.
it can also make it like. Yeah.
It depends on the market situation.
Yeah, it's true.
Yeah, it's,
Okay.
I'm fine with that.
Do you agree?
Yeah, it's fine.
Okay, let's see.
It was easier last time.
Yeah. We got
Are we the first one?
Not this time. Not as speedy as last time. Yeah, with Locker. The commission was speedier this time.
Were you able to bring in the commission again?
The
we can have a lot of criticism about, is the model that's a good. But for us, this is an important point that we discover also talking to each other. That sometimes we are closer than we think, and sometimes we are further removed than we think, just by playing this game.
I don't agree with that, by the way, just for the record.
So please bring your actions if you haven't brought your support actions yet. So they only have one? Okay. If you have made all your support decisions, please, you're invited to take a seat and to join the panel discussion. Before that, we're going to show the results of your second round. Yeah. Sorry, it's too late.
We are from the Ministry of Finance.
Yeah, I'm sorry, it's too late. No, I'm sorry. Thank you so much for your decision. So, ladies and gentlemen, we're halfway through the results of the second round. We're going to do it expedited. And we can see that your sacrifice, I would almost say, to go beyond your own organizational KPI and to really support competition and competitiveness, actually it's bearing fruit. Because look, we're moving towards the line that we at least wanted to reach in Europe. Innovation actually has suffered from it, so that is something which is something we actually never wanted to happen, but let's see if the research and development based industries can change that. They also made a decision to improve competition, so to the cost of innovation. And we're almost to the end. Here's the last one, research and development partners. Ah, yes. Saved by the bell. So, ladies and gentlemen, this is the end of round 2. We're not completely in the green with everything, but at least we have made the minimum mark. So thank you so much for your, not just your enthusiasm, but also your patience and your understanding with the fact that the disclaimer that I mentioned in the beginning, this is not a real academic model, it's not real life, it's a game. But hopefully it has encouraged you to have a discussion that maybe normally you wouldn't have with the people around the table. And hopefully it has also primed you to raise some questions in the next panel discussions. And with that, I'd like to hand over the microphone to the panel discussion moderator.
Thank you very much, Arnold, for moderating the game so wonderfully. Thank you to all of you for taking part in the game actively and for going beyond your institutional hat in supporting your colleagues. So I would like to invite up to the stage our panelists. I think we've all been waiting with bated breath to hear from them. We have Nick Fahy, I will call you as I see you, from RAND, so Nick, join us. Yanis from ESIP, Natalie from FPA, and Kaisa from the European Patients Forum. Join me, please. This was indeed a very interesting game. I have to admit I hadn't played the game before, I haven't seen the game before, and I fully understand that it's not an exact science. Some of these movements of the indicators surprised me as a result of specific actions. So for example, I didn't understand why needs-based innovation would diminish competitiveness, but we can discuss this. I mean, I'm sure that for some of you, many of the concepts were new, for some of you they were not. I think it was, of course, we're grateful on the panel that we got more time because you expedited the second round of the game. But at the same time, it would have been interesting to have a bit more time to see which of the actions led to which movements and were supported. We saw which group suggested them and which didn't. But I think what it clearly showed us are the different interests and the different positions within one shared goal, which is actually enabling access to effective medicines, and how that things can change when we think perhaps together or support each other, let's say at the moonshot level. I would like to ask our panelists, and I will start with Natalie on the far side. What is your takeaway from the game? I don't know if you were in the game at all, but what is your takeaway from the game? What can we learn from it?
No, so we weren't allowed to be in the game. We had to observe the game. What I take away from the game and what I've learned in the last 5.5 years working on this side of industries, that it's very hard to be in somebody else's shoes, right? Because first of all, you don't have those responsibilities. You represent a sector that you know well. You understand the complexities of who you represent and what your needs are. And you try to understand the other elements, but there are lots. They're not, I mean, did you see how many stakeholders there are? There are so many. So I think that is the complexity of our healthcare world is enormous. And it's very rare that we are able to all come together to discuss. So this was very nice because I think we all had an opportunity in a way to mini-discuss with each other. And I think it was here 5 years ago where I said, I just want to sit around a table and get us all to talk and find solutions together. The other thing that I took away from the game is that we saw, it's just a game, good, but we saw some of the impacts. But of course, that's of a snapshot of today. So the impact, for example, on innovation, you don't see the impact, so what innovation does to the other criteria until there is no innovation. So it might have an impact on innovation, reducing innovation, and that may not have that much of an impact on the other things at that moment. But if you run out of innovation, then you have no more new therapies, and then you'll have an impact on everything else. And the same with competitiveness. When it's low, on the moment it's low, but what happens then is you have people start divesting in the region, and there'll be less innovation. So they're also connected to each other, and there's a time element that I think we couldn't capture with the game that gives it a 3D dimension.
It would take us a week probably to simulate, and even harder mathematical models behind it, I guess. But it's a very good point to bring to the table, that when we think about solutions, we think sometimes of the short-term solutions and the short-term effects, but we need to look ahead. And I think when we come to talk about specifically the EU's role and the new or expected revision of the legislation, perhaps we reflect on that a bit as well. Kaisa, you're next in my sitting order here. What is your takeaway message from this game today?
Thank you. Yes, thank you. It was very interesting to observe the game, and I think it's one thing that is clear is that everyone seemed to put a very high priority on universal access and meeting societal needs, and obviously securing the quality, safety, and efficacy of new therapies. And I think that's right. To me, those have to be the priorities. But obviously, there are different parameters at play. I had some doubts about the definition of competition and competitiveness. I think there's some internal tension between those concepts. So maybe, in this game, we didn't have enough granularity to tease out all the issues. But nevertheless, it was interesting just to see people try to put themselves into another stakeholder's shoes. And yet there was such a high consensus on those certain elements. That was very interesting to me.
Thank you. I think this is an important point to highlight, the difficulty of people taking on a different role. There was an additional layer of complexity there because people were actually allocated to groups that they did not belong to. So it was a double. So maybe they were advocating to the group that they would actually belong to. So there's a lot of interesting interaction there. And hopefully we'll have a little bit of time at the end to hear from the game participants as well, how they experienced it. But I think it's a very important point to highlight. So thank you. Yanis, over to you.
Yes, thank you. Just to say, I mean, for us, working very well with our MSD colleagues in designing this session, I think it is clear that also representing the payers, there is a clear desire to work together. And why is that? It's not because we're trying to be nice to each other. We've also been nasty to each other in the past. But now I think the challenges are so daunting and shared that we need to get very concrete and we need to understand each other's perspective. And from what I hear, at least from my members, the statutory social security institutions that cover the entire spectrum of social protection, including having to pay for healthcare, is that we are in very dangerous, I would say, times with daunting challenges and uncertainties. And therefore, I think for the purpose of this session, we need to make sure that we don't get to the point of having to answer the question or having a dilemma, is it innovation or is it solidarity? And that is something that we need to be careful, because I think we all agree and that we need, as Kaisa said, we need to satisfy society, we need to meet societal needs. And for that, we do need innovation. And of course, the private sector has an important role to play. And therefore, that's where we all need to show tangibly that we're willing to adapt to these new challenges, and that also has to do with my own constituency, because otherwise we're gonna have dilemmas that we cannot get out from, and we're gonna get into a dead-end situation in Europe. I'll stop here and then we can...
Thank you. Yes, we return to this really important balance in a minute. Nick, what is your takeaway from the game? Gamification as such is a good way of really getting into a different role and understanding the other perspective, perhaps.
No, absolutely. So, I mean, the first thing I would say from a sort of an academic and a research perspective is that this is an opportunity to be asking exactly the right kind of question, which is to be seeing this as an ecosystem. Because in the research that we do and in the questions that we get asked, we so often get asked for research which is essentially enabling one actor within the system to help make their case to another part of the system. And in this room earlier today, we were talking about how do we make the case to finance ministers? How do we talk about it? And I think what was really powerful about this way of looking at it is to make the point of the interdependencies, that this is a system and that we need to understand it as a system, and actually sitting in one part of it and saying, well, how do I make the case that what I need out of it is this, as strongly as possible, is ultimately not going to get us what we need. We need a system that works overall. And we recently were able to do, we were very happy to work with some colleagues doing a study on the financial ecosystem of pharmaceutical R&D for the Dutch Ministry of Health. And what came out of that, without rehearsing the whole messages of the study, it's on our website, please go and read it, was exactly this, that no one gets what they need out of this system without understanding the interactions of the system as a whole. And that's difficult for us to do, and it's difficult to research, and it's challenging for us all as stakeholders to accept. But that is the starting point to actually get us to some kind of constructive set of outcomes. And as colleagues have already said, actually there's enormous alignment about what the outcomes are that we all want. And so the challenge is, how can we better collectively manage this system?
Yes. So you pose the question for the second round. You're going to have to answer it. This is your challenge, Nick. But I think this is quite importantly, and this is what I meant. I was joking in a way when I said that we didn't have enough time to look at the actions, because we saw that in the end, maybe with two KPIs suffering still, and that was innovation and competitiveness, if I remember correctly. All the others were in the green or the blue on this screen. How did we manage that? What were the actions that actually were successfully doing that? So clearly, we can't take them one-to-one because this is a game. But we have initiatives in the past few years that answered your call, Natalie, to have a structured dialogue. We have the Oslo Medicines Initiative. We had a session about that yesterday, I think. We had, in the context of the EU Pharma strategy and the revision of the legislation, a lot of consultations and different types of public opinion gathering. So what do you think, coming out of all these joint initiatives and thinking and today's experience, how can we actually balance a healthy innovation system on the one side with the sustainable, equitable access to high-quality medicines for those who need them? What are the actions that we can take? We saw so many different options for all our different groups, but which are the ones, let's say, that we should be focusing on moving forward so that we can, within the ecosystem, strive for that goal? It's the impossible question, Nick?
No.
I mean, you posed it, so
yeah,
back to you.
So I'm here as the researcher, so I'm going to be academic and theoretical. That's my job. When you draw a system, what do you do? Basic systems mapping. You take your different components of the system, and then you draw the relationships between the system. And the thing that drives how well the system produces what it produces or doesn't, and stabilizes or doesn't stabilize, is those connections. And for me, I think that one of the key things that we aren't doing well enough yet is understanding those connections from the sort of, if you like, the patient end of the system all the way back to the early stage. We're good at creating the individual steps along the way. But if I were to draw this system, we have actually several self-contained systems along the way and not linkages that go from the start to the end. And if I were to take an example around that, one of the areas that we've found it really, really hard, which I think is a test case for this, is what we were talking about in the plenary earlier today, which is One Health and antimicrobial resistance. We have an enormous discussion around how do we create incentives for generating the right kinds of vaccines, therapeutics, interventions. And we know that there's a clear endpoint need, but we're struggling to make the linkages back to the research decisions and the financing decisions and the different stages along that process. So we need the linkages not just from each stage to the previous stage, but the things that align the system as a whole. I have no miracle solutions as to how we do that. That's a much longer answer to the question. But that's the basic approach that I think that we need to take.
Okay, I'll allow that. We're not going to go directly back. So I would like to go to Kaisa, if that's okay for you. Natalie, then to you, and then we go to Yannis.
Sure. Thank you. I think I'm going to pick on one point, and that was the point about patient engagement. And I want to elaborate on that a little bit, because I would actually go further than what was described in the game as patient engagement in decision-making. And I would argue that building patient input, whether through whatever means, whether it's patient dialogue, where patient outcome prioritization, data on priority outcomes, whether it's patient preference studies, all of this needs to be mainstreamed and upstreamed into the entire R&D chain, so that the whole therapeutic development process starts with what are the patient's priorities in terms of what do they expect and want from new therapies, what are the right research questions to ask, what are the right outcomes to endpoints to build into clinical trials, everything that then, and I would argue that will then result in a better value product when it comes down to the regulatory stage of the process, and it will help bridge that gap between the following stages, HTAs, pricing and reimbursement, and I think there's that link to the added therapeutic value that you get only by involving patients from throughout the chain. How to do it is a bit more complex process, and I think there are many things that need to be discussed. But last week I was at the European Medicines Agency, where we had a very interesting workshop on exactly that how to embed what they call then patient experience data, covering all of what I've just said, into this. And I think that's going to be the key.
Thank you. I think this is a really, really clear message and a key takeaway. And Kajsa, I'm going to come back to that with you when we talk about the room for that in the new EU framework. Natalie, I think.
So one thing not to do is trial and error. I would really encourage us not to say, well, let's just try this and see how that works, because the patients' lives hang in the balance here, right? So this is not something where we can empirically see, well, if we link this with that, let's see what happens. This is not the place to do that. So for me and for us as an industry, what really we've been calling for from the beginning is, can we all please analyze what the obstacles are to each of the things that we want to fix, but really analyze. And can we please then sit down and agree whether we agree on the analysis or not, and just come to a set of obstacles that we all agree, this we need to fix. Like, if we don't fix this, it's never going to work. Because the issue is, at the moment, it feels a little bit like, a little bit like before we did this game, everybody knows what their problem is and they want to fix it, right? And that leads a bit to a trial and error, which we can't afford. So I think one important ingredient would be to analyze and agree on what the obstacles are, which are the issues to fix, and then all agree on the actions and the responsibilities, and then measure the success of those actions. Now, that means taking accountability, that means a lot of discussion, and it means dropping some actions in favor of others. But I really think that there is no other way forward because of the complexity that we just discussed. We go to so many events where, the OECD says there's 20% waste in healthcare system. Oh, that's terrible, yes. And then, but here, this new technology means that you don't have to have transplants anymore. Oh, that's great savings. But somehow we never connect all those bits, right? There's no money, as Yanis was saying in a much more diplomatic way. After COVID, after Ukraine, there is very little money, and patient needs have not decreased, on the contrary. So it really is a moment. I think that would be the most important thing, to sit down, analyze what the obstacles are, whether it's in access, whether it's an unmet medical need, whether it's the regulatory future-proofing that we need, rare diseases, pediatrics. Sit down, these are the obstacles, or these are the objectives we want. What should we do as actions? And then measure. So we've tried to do that as an industry on access, because that part of that is our responsibility, right? So after finger pointing all of us to all of us, after 3 years of trying to think out of the box, we came with an analysis of obstacles. We did it again just to check. We published it, and then we said, okay, what can we do to deal with it? And we put some actions, but some of the things we can't do on our own. And we need to sit together. So for me, it's really a non-trial and error and a really collegial and very measurable commitment that I think we need.
Thank you very much. I think that's also a very clear message and a nice bridge to Yanis, who I think goes in the similar direction.
Absolutely, and I agree also both with Natalie and with Kajsa, and this is why at ESIP we agreed that we need to take things from the beginning, and this is why we presented a very detailed set of recommendations, amendments to the marketing authorization system, just to go back to what Kajsa was saying, in order to really get meaningful innovation and to try to drive and steer meaningful innovation, that because we as payers as well, we are willing and we are ready to reward meaningful innovation. And this is why we presented this set of recommendations. You can find them essentially aiming to have strong evidence early on, engagement and involvement, substantial involvement, because it's not only the patients who left out at times, it's also us and the HTAs who feel left out from having this early on dialogue where we can really sit down together and agree on what kind of questions we want to have answered and where do we want to set the bar in order to have the right evidence. And this is why we are totally in favor of strong evidence for what we call informed and timely decisions. And I want to repeat that the questions that you hear from the pricing and reimbursement authorities, from the health technology assessment agencies, those are not because they're not a nuisance. These are questions that actually need to be acknowledged. These are evidence needs that need to be acknowledged. It's not about winning time or procrastinating. On the contrary, If we manage to get better evidence early on, then we will be able to have also faster access to evidence-based healthcare. This is what we are striving for, and I think that's where we can agree with patients, but also with the industry, because we do see, and this is where the only nuance I want to add to what Natalie just said, is that trial and error, yes, indeed, we need to be very careful because we don't want to make some irreversible or cause some irreversible damage, but at the same time, I do believe that it is an opportunity to look back and learn from the experience that we have with certain pieces of legislation. And I think that's where we are right now with this incredible opportunity that we have. Who would have thought? I remember we were here in Gerstein that we would get to the point of really discussing reopening the marketing authorization system. I remember you saying I would put all my FPS staff working on that. And look at where. Yeah, and look at where we are. Look at where we are now. So we are a bit concerned with this trend that we see of having these accelerated approvals, a push for ever more accelerated approvals, because we see that in most cases, faster access means poor data. Poor data doesn't necessarily always mean poor drugs. No. I want to be very, very nuanced. But when you have poor data combined with very high prices, for us, that's a huge problem. It is a huge problem because this is a conundrum that has a real negative impact on people's lives. Stop here. Thank you very much.
Yes, thank you, Yannis. Before we go to our audience for your inputs and your questions to the panel, we saw very interestingly, and this is one other thing that I would have wished to have more time for, who was supported by whom, right? And we saw the professionals were not supported by anyone, or the innovators were not supported by anyone, but the European Commission was supported by everyone. I don't think that was the case, but you know what I mean. And I heard from all of you what we should aim for. Who should you feel or do you need supporting you, your work? And what is the room there for the EU in light of the new legislation and the EU Pharma strategy? What is the support that you need? Because I heard from all of you this needs to happen. And so my question is, whose job is it to put the ball rolling to get that actually done, from your perspective? I think we start with Kaisa again, if that's okay. We come back to Nick.
Such an easy question,
yeah?
Dimi.
Of course it's not. That. That's why we're here. All the easy questions have been answered.
Patient organizations talk to everybody. Mm-hmm. I mean, we are in touch with all of the other stakeholders. And whose job is it? Well, it's kind of everybody's. It's also our job. What I was saying before about patient experience data and patient input, there are methodologies. So regulators have some knowledge, HTAs have some knowledge, academia has knowledge, we have knowledge, industry has. So I don't think it's an insurmountable thing at all. What is the question is which parts of these are in the scope of the new legislation and which are things that need to be worked out outside of that, but linked. So the early dialogues, for example, the collaboration, downstream collaboration and so on. But I think we have had a sort of kickstart at the EMA, and the regulators are definitely taking a leading role here, which is very nice. I wanted to make one point. Actually, I slightly disagree with you, Yannis, on the poor data, because sometimes there is just no possibility to have very robust data. Then it's a question of, understanding what kind of risk, for example, the patients are willing to take, which may be a different risk from that acceptable to regulators or your members. Now, the pricing is a different question, so I wouldn't go there, but there are spaces for different types of processes, I think. And if I may just say one more thing, I think it would be good to be clear and honest in these debates that we're having also with European Commission and member states about what we are talking about when we are talking about unmet needs, because at the moment I have a feeling that nobody agrees. And societal needs are one thing, and it's very legitimate. And then individual patient needs is a different thing. Yes. And there are so many nuances and gradations to that.
Hold that point and explain it to us in a minute when we come back to that, yeah?
I will hold it.
Nick. You were next. You still remember the question?
Oh, yeah.
Okay.
I mean, from researchers, from our point of view, it's very tempting as researchers to, as one of my colleagues says, the easiest thing in the world as a researcher is for people to do things and for then us to come in afterwards and survey the wreckage and explain in painful detail why everything went wrong. And that's not very helpful. It's sometimes amusing, but it's not very helpful. So the key challenge from our point of view, and which is what we try and do in RAND, is to be part of not just being research which happens afterwards, but to be part of answering the question, Natalie, that you put on the table, which is how can we do this in an actual evidence-based way? The plea that I would, your question was who needs to do what?
Yes.
We will do the work. But what we need is the access to the information to be able to assess that. We need the access to the data. And that gets very quickly, like the limiting factor in doing research about this whole ecosystem is this ecosystem is full of stakeholders where, perhaps with the honourable exception of the patients, no stakeholder wants to show what cards they hold. It's like a poker game and everyone is sort of sat there holding on to their cards and saying, well, I'll maybe put this one down if you'll put one down as well. And as researchers, we're sat there saying, well, if you don't show us anything, then we can't measure anything.
Mm-hmm.
So somehow for us, I mean, everyone has legitimate interests to protect in all of this. That's obvious. You can't just expect everything to be put on the table. But somehow finding ways of creating the spaces and the trust and the opportunities where you can exchange enough in enough trusted ways for us as the people who can generate some of this evidence to be able to provide some of the analysis that would help do this would, I think, help to sort of take this from the rhetoric to understanding, coming back to the fundamental point, understanding the interactions of the ecosystem in a more meaningful and evidence-based way.
Thank you. And who will do that? You will do the work. I will ask you about your wish list to the Commission in the final round of comments, and then you can think about it in the meantime. Natalie, we'll end with you. Not yet. Jan is first.
Yes. Well, my concern is that this is an already very complex agenda, and following the pandemic and with the perma crisis that we're facing, it got even more complicated, and with more layers of complexity added. And that's where I'm a bit concerned, because even in Brussels, I think the Commission has a lot of voices in its mind, and they're trying to make everyone happy. And there is such a big plethora of topics on the agenda, and I think we need to be somehow strategic, because I don't know how else we're going to get it right. And at the same time, I don't necessarily see in the Council and the government, so I'm trying to answer your question, who is going to really try to do and get this done. In the Council, I think governments are so busy with everything else happening at the same time that there's no real headspace necessarily to focus on this unprecedented opportunity that we have, this fundamental piece. For me, it's the most important piece of legislation, or we will see what comes out of it next spring. But it's much bigger than the HTA regulation or anything like that. So I'm a bit concerned, because I think there are way too many topics on the agenda. There's no clear priority setting. And at the same time, the political will, I don't see any clear direction. I don't see any clear strategic thinking. This is where I'm a bit alarmed.
Okay. Thank you. Natalie, we wrap up with you before we go to our colleagues here in the room.
Yep. Thanks, Jimmy. So, again, I'm going to go back to everybody needs to take their responsibility. So when I joined FP, I realized that we didn't have a group of stakeholders that covered the entire healthcare system. And everybody pulled their blanket to themselves, right? So because it's true, healthcare systems are made like that. There's a budget for hospitals and a budget for pharma and a budget for this and a budget for that. So everybody's going, and the blanket is getting smaller and smaller. The issue is, we're trying to cover the patient with a blanket, so pulling the blanket to ourselves doesn't help. And so we've been trying to create a coalition, an EU health coalition, so that we can all talk together. It took me 11 months just to convince 40 associations to sit in the room. Some of them said to me, we're not sitting, we have meetings without you, we're not coming, which was really, for me, difficult to hear that. Maybe I was really green behind the ears, but whatever. And even then, just to keep it going, and then it doesn't really matter if it's happening at European level, because it has to happen at national level, because the people in the ministries need to have a healthcare system speaking to them, asking one thing, not 15 different, please leave the budget to me, or leave it. So, because it's very hard for a ministry, I can imagine, to decide what am I going to fund, what I'm not going to fund. So I think stakeholders need to take their responsibilities to get organized and come with one voice, and it means concessions. It means concessions. So I think we need to be understanding of that. Then I would say each bit of the healthcare systems need to take the responsibility to do something that makes a difference. So you were talking about evidence. People don't want to give evidence. But the portal that we've set up as an industry, every 6 months we collect evidence of, have our members stuck to their commitment of putting products on all 27 markets within 2 years of marketing authorization? And where is that product in which country? Why is it blocked? What is the reason? And at the end of 2 years, we will be able to show that data, to be able to show it's not moving here because of that. That's real evidence. So it's no longer, because the company didn't have a market, or because they wouldn't give us a price. We will really have evidence to show. And that's the only way you can address it, because if you don't know what the problem is, you don't know how to fix it. And the last thing I would say, to go back to who's the responsibility of proposals, what you were talking about, unmet medical need. For me right now, when I read the comments going around on unmet medical need in the different reflections of the Commission or the Member States, it feels a little bit like trial and error. It's a bit scary when I look at it. And I don't think everybody who needs to be involved is involved in deciding, if we can ever decide, what an unmet patient need is, because it's not a medical need. And it's scary to see, let's just lock it down in legislation, because the more science evolves, the more we're able to delve deeper into unmet medical need, right? So I think we need to be careful, understanding though that we have to be able to focus and respond to as many unmet medical needs as possible. It feels that we're not being evidence-based enough. And so I think on unmet medical need, on incentives linked to access, it feels a little bit like a trial and error that is scary to me. So, yeah.
So you're not giving the mandate to the Commission just yet on that?
But to bring us together, yes. Mm-hmm. So to bring all the stakeholders together, and how. I don't see who else would do it, right? So.
Well, I mean, we come back to that. We had the Oslo Medicines Initiative session, for example. So that's also an initiative that brings dialogue around the table, right? So this is something that is beyond the European Union. But I think because we are linked to this thinking of the upcoming EU framework, we're thinking about that in first line. We're going to our colleagues in the room. Reflections on the game or direct questions to our panelists or comments. Don't be shy. We don't have a lot of time, but we could take one or two. I have more, so I can keep going. But it's a chance, and we have really good people here. Yes?
Hi, this is Carlo from Politico. I had a question about, so there's this saying, right, that generals always fight, the last war. I wanted to ask, is the thinking around the pharmaceutical strategy, what we know so far, obviously it's not published, is it addressed to what the industry is going to look like in 10 years? Just because I'm aware that there's accelerating technological change, and that this could really affect the system as a whole, to bring it back to the system that Nick mentioned. So I wanted to know, do we risk creating a regulatory framework that really works well for medicines that are going to be basically obsolete in a decade?
Give you some time to think about that, colleagues. Anyone else? Comment, question, suggestion? I mean, what is interesting for me is the timing of the session, which coincides with a parallel session, which is, I think, hosted by the Commission. So I don't think we have as many people from the Commission here as we could have had, because that would have been also quite interesting. I think we have an eye on online. Do we have anything from the... No? Okay. I mean, they missed the whole fun of the game as well, so we will be lenient. All right, so we have one point, which is, are we going to have a new regulatory framework? I don't know how many of you have seen the ideas behind the proposal that will be coming and isn't there yet. Do we think that the upcoming legislation, revised legislation, will be fit for the future, the way that we've been discussing that our health systems should be. I think, given the time, we're going to merge the answer to this question with the final reflection that I would like to ask all of you to give us, which is your wish list for this proposal. Maybe not everything, because we don't have time for that. But think about picking 2 things that you absolutely want to see in the new proposed, revised regulatory framework. And think about whether these 2 things then give us a future-proof solution. I'll give you a minute. It's not easy. Of course, I'll start with Nick. Nick already knows.
All right, okay. Seeing as we're short of time, I'll jump in, and then those more informed on the topic can go. I would say 2 things. I am not going to comment on the detail of the Commission proposal. I have no idea what's in it, and besides, I used to work for the Commission, and I probably shouldn't. I've been very carefully not talking about any of those things while I'm up here wearing a different hat. But I would say there are 2 things that I would look for. One is that when we look at marketing authorization, that we not look at marketing authorization as the end of a process. The end of the process is when the patient gets what the patient needs, and when the health system can function in the way that the health system needs to function, and we generate the societal goals that we need to achieve. And the marketing authorization is not the end of that process. It is a halfway stage in that process. And part of how we ensure the financial headroom that pays for that, following on from Natalie's point from earlier, is by also managing the better use of the technology that we've already got and the new technology that's coming. And that means data, and it means implementation, and it means digital, and it means all of those things that we don't have time to go into now. But the point is, it is one part. I'm coming back to my fundamental point, which is it is one part of a system, and we need to see it and build in things like data requirements, not just before but also afterwards, to enable it to function as one part of a system. And then the second thing I would say, which is something we haven't touched on hugely, is that the European pharma ecosystem is one relatively small part of a global pharma ecosystem. And the United States healthcare system is bigger in revenue terms than every single European Union healthcare system put together, quite substantially so. So, and the Chinese healthcare system is also, if you talk about 10 years in the future, will become a it's already a very powerful force. It will become only even more so. So whatever we come up with as our vision of what Europe is seeking to achieve and the structures that we're trying to create in order to achieve it has to take into account that it's one milestone in the overall system, and the system is global, not just European.
Thank you, Nick, very much for your reflection. I think we just continue in sequence, Yannis.
Well, very, very concretely, 3 points of emphasis looking ahead, and I'll come also to the question about Carlos' question about the future. Evidence generation, competition, just to make sure that we got that. And bringing the public side together. Make sure that you strengthen that side of the table in the negotiations. And how do you do that? By enabling the exchange of information. Make sure that you have a level playing field, because we know that in the imbalanced, in my opinion, pharmaceutical systems that we have in Europe, you need to make sure that the payers slowly evolve into becoming empowered, informed buyers, and I don't think we're there yet. And how do you do that? And the Commission should keep that in mind in looking at the Pharma revision, to strengthen the information and the collaboration on the public interest side, especially because we know, and we need to be frank and honest, there are limitations when it comes to resources, the pooling of expertise. We heard yesterday that in some member states, and I can tell you this is also what I hear from my national members, they don't have enough manpower and expertise in-house in order to be able to process also the innovation that is coming their way. And so that is also part of the reality, because we need to, Casper's session this morning, we said we need to stay close to the reality on the ground. Mm-hmm. So from my side, and keeping in mind that the members that I represent, which is these national giants that really are about defending and safeguarding solidarity in practice and social protection on the ground, they need to be well equipped in order to deal with the challenges. And Carlo, yes, it is important to keep in mind, and of course, every piece of legislation, I remember also the discussions we had with the HTA regulation, any and every piece of legislation needs to be future-proof, and hopefully the legislator is not going to get lost in very complicated technical details, as I fear it's going to happen with the European Health Data Space proposal, where you bring lawyers with IT people together. Next session, voila. But we need to have something that is operational, that works on the ground, and otherwise it's going to be a self-defeating exercise. So yes, we keep in mind the decade or even 20 years, because this is a once in, I think, Natalie, you will agree, and once in 20 or 25 years opportunity. But let's also keep in mind the current problems and the imbalances that we've seen in Europe over the past 20 years, and look at the lessons and what we can fix. I'll stop here.
Thank you very much, Yanis. Kaisa, we come over to you.
Well, you know, patients want everything. They want the access, they want the innovation, they want the quality, safety, and efficacy. Okay, I think what we want to see from the legislation is something that helps deliver better therapies for patients. And I mean, I'm not saying innovation, because I want to say innovation that is truly innovative, that is truly better than what was there before. And that is solidly based on public good objectives or public health objectives, and really helps. And then a little bit on what Nick said, that is seen as in a contextualized way, and that facilitates the connections between the different stages, also the parts that are not covered by the legislation as such, like early dialogues, like HDA's pricing and reimbursement dialogues. And of course, I think it is possible, and we haven't worked it out yet how, but I think it's possible to build in a requirement for patient perspective to be embedded throughout, and for patients to be involved. I would also say structurally involved. And to Carlos' point, I don't know what's going to come out of it, but it should be future-proofed, and it should have enough flexibilities built in to be able to adapt to the scientific developments, because, you know, we cannot have probably not the same text 30 years from now that we have today. So,
thank you very much. Or the text needs to look a certain way so that it's flexible. I think it reflects a bit on what Natalie was saying earlier as well. Natalie, final words from you.
Yeah, so I think we need to decide what we can fix with legislation and what we can't. That would be a great first step, because there are some things that this legislation is not going to fix, right? So access, for me, is much more urgent than however long this is going to take. And we need some concrete actions now on access. I don't think that a legislation made for marketing authorization or for incentives is going to fix access. But you know that this is the point of view of the industry. So this is the first idea. What are we going to fix with legislation? What do we need to fix with legislation? What can we not? And what do we need to do otherwise? And then I would do the learning from the past, which Janice mentioned. Let's learn from the past what has worked. Okay, we were late with orphan drug legislation. We were really late, but it worked. We did a good job. I was already around. But when the orphan drug regulation was approved, you know, we had those 8 products. Now we have more than 200 and X. We have SMEs, so it works. So clearly, we are actually, when we try to incentivize research, it works. So that's good. So with legislation, you can incentivize research and you can get new treatments. Okay, so that works. So let's in this legislation make sure that we create those stable and predictable incentive frameworks that foster research. That means stable and predictable, and you know that I'll say that for an industry not reduced, because the rest of the world is increasing incentives. So let's be serious and compare ourselves to the rest of the world and say, okay, what are we trying to incentivize? That innovation that's coming, that would be one. And the other one is indeed, for me, the future-proof regulatory system that is competitive with the rest of the world. Again, because we want global harmonization, because we want to be as efficient as we can, because there's no money. We want to make sure that we have products approved as quickly as possible that can be used around the world. based on super solid evidence, as solid as it can be. And if it's difficult because the cohorts are smaller, let's adapt, let's be smart, let's use digital, let's use all the tools that we have. Let's make it flexible enough so that we can adapt it with technology as it evolves. We have a number of proposals as industry. We had 4 legislative ones, 8 non-legislative ones. You know, we have as many as you like. But those, for me, are the 2 areas that with legislation, we know that by legislating, we can make step improvements. The areas that we can't fix with legislation, let's not try, because we're going to tie our hands behind our backs. It's going to be a trial and error, and the people who are going to suffer the most, I believe, are patients in the end. So that'll be it.
Thank you very much. And I think very loud messages from all of our stakeholders. I think they reflect also the need to be walking in other stakeholders' shoes that you also felt during the game. We are being kicked out very subtly from different sides because we ran over time. So I would like to take the opportunity to thank our panelists very much for the honest and the very actually really hands-on points that they brought. It's a very important issue. We're all really waiting to see what's going to come out of the deliberation. Thank all of you for participating in the game. Thank ESIP and MSD for organizing the session, and wish you all a very nice rest of the evening and the rest of the conference, and see you next year, hopefully.